Welcome, students, to probably what I believe is the most fascinating part of the class, which is the construction of the biological profile. Now, the biological profile contains a number of different components. Since you have under your belt some ideas about the history and methods in forensic anthropology, a cursory knowledge of the human skeleton, including the skull and the postcranial bones, as well as we worked on crime scene investigation and the postmortem interval. Now we can move into the biological profile, which is the types of things that we can infer from human skeletal remains. And the first component we're going to start with is biological sex. Biological sex is just one component of the biological profile. You can see that the biological profile is, what includes, and it's not limited to, things like a determination of the sex of the individual from the skeleton. Now remember, we're talking about biological sex. That is those specific components of the skeleton that have actually gone through and displayed some of what is known as the adult secondary sexual characteristics. That is, during development and growth, you have enough hormones pumping through your body that are differential between those that are biological male or female, and that eventually affects the skeleton. We also know that there might be some very subtle differences between males and females during childhood, and we have forensic anthropologists that are working on those research questions as we speak. So a lot of times we can't necessarily tell biological sex from remains of children that are younger than about 15. Once we get into about 15 to 20 and into adulthood, then we can see, right around the time and the stage of puberty, we begin to see some of those, what I had termed secondary sexual characteristics. And remember that this is different from gender. Gender is how you see yourself based on biological characteristics, as well as how your culture perceives this interpretation. And it also dictates, the clothes you wear, your mannerisms, and how you act. So other components of the biological profile that we're going to go through are age at death, ancestry, living stature or stature estimation. And then the last part of the course, we may have a separate section that will focus on pathology. When we try to determine biological sex from human skeletal remains, there are a number of different ways that you can do it. However, the two areas that typically have the most sexual dimorphism, right? Di meaning two, morph meaning shape or a characteristic of. It looks like the skull and the pelvis are the most accurate based on a number of different testing methods for determining biological sex from the human skeleton. If you were to choose one or the other, the pelvis has probably been shown to be the most accurate. So if you have a full skeleton, you will use all the observations you have from the skull and the pelvis, and there are other techniques that can be used on long bones that we won't really get into. But the pelvis is usually the most accurate with testing methods, as well as it usually has a number of different components to it that have to do with childbirth that make the pelvis different in females and males. We also see differences in the skull of males and females. They might not be as prominent in the pelvis, and it does depend on their expression. But the pelvis is probably a better determination than the skull for sexing the human skeleton. When you look at the human skull, there are a number of different components that we observe that suggest that the skull belongs to a male individual. And so one of those characteristics is the chin. And you can see here we've got The Rock, and he has a nice square chin. Males typically have a chin that is square. It looks kind of like a box just below the lips. And it looks rigid, and it is more defined in comparison to females. Males also have typically a flaring gonion. Gonion is an area that's probably the most lateral expression as a point on the mandible. And you will get what's known as gonial flare, where it will flare out even more laterally in terms of a projection and expression. And you can see here Brad Pitt has a really nice flaring gonial angle where the chin is extended even further laterally. You can also see that Brad Pitt has a nice square chin. You can see that it almost kind of protrudes out in the area of his facial hair or goatee. Prominent brow ridges or supraorbital ridge. Supra meaning above, orbital meaning above, the orbit. So above the orbits. This is Charles Darwin here. He has a very prominent brow ridge. Look how much bone is produced here on the inferior aspect of the frontal bone. Males typically have a very prominent brow ridge in respects to females. So these are some components, not all, that we can observe to determine whether the skull is that belonging to a male or a female adult. When we look at the skulls of females, there are a number of different components that you can see that are different from males. Female skulls are usually much more gracile, and the features aren't as prominent as males. So you can see in terms of the brow ridge in the picture in the upper right, you can see that it's nowhere really to be present. It's almost absent, doesn't necessarily exist. You can saw that Charles Darwin's brow ridge was very prominent by comparison. You can see Jennifer Love Hewitt here. You can look at her chin, right? It's not rigid or boxy or square like a male. It's actually nice and rounded, and it has softer features. If you look at the jawline of the woman in the center with the arrow pointing to the area of gonion or the gonial angle, there isn't really much of a flare. It doesn't protrude out laterally like we see in males or the picture with Brad Pitt. Now, you may see some females with gonial flare. There are some European models that actually present with it, but then a number of their other features look predominantly female. And this is why when we try to determine sex from the skull, we likely need to use a number of different features in consort, in unison, because one feature might not be clearly male or female, and then another feature might be predominantly male, and another one might actually look female. It happens all the time, and it does depend on differences we've seen between ancestral groups, or what we would think as racial groups. But we'll work on that terminology as we move forward. Anthropologists typically use ancestry or ancestral heritage as a means to discuss people that look slightly different in their biology from major continental groups. So here are a number of features, like the mental eminence, which is the last one on the bottom, or the mandibular symphysis, right? Those two terms are synonymous, but you can see in the scoring chart, if you see a very square, prominent chin, very large features, then you would score that a 5. If you see an individual with a very small and rounded mental eminence or mandibular symphysis, then you might score that a 1, and that's more of a female feature. Now you can see that there is gradient in expression, of course. The brow ridge, the supraorbital ridge, or glabella. That's the second from the bottom. You can see Darwin would be a 5. Very, very thick, prominent brow ridge, but then a female that's very gracile would be a 1. There are other components like the supraorbital margin, moving from the bottom to the middle. This is the margin, right, that is lateral expression on your eye orbit. Males typically, because they have large brow ridges, will have a rounded and thicker supraorbital margin, whereas very gracile females will have one that's very sharp and almost non-existent. The mastoid process, right? This was a feature we talked about on the temporal bone that was important to remember in terms of musculature difference. Now, of course, between males and females, males will typically have larger musculature. They are typically larger in size, and this is something that we see in the differences between biological sex that we inherited from the African apes. Whereas, a male gorilla is about 500 pounds and female is about 250. And we also see those differences in chimpanzees and bonobos, which we're more closely related to. This has to do with the sternocleidomastoid. It is sternocleidomastoid is a muscle that connects both the mastoid process and the medial aspect of the clavicle. And males typically have larger musculature. They're going to have a larger mastoid process. And so the size of the mastoid process, the length of the mastoid process as it extends inferiorly from the external auditory meatus or the ear hole, you would give that a 5 if it was a very large one, and then a 1 if it doesn't really extend at all. I've seen ones that don't even extend past the ear hole or the external auditory meatus. The nuchal crest at the top, right? This is on the occipital. That's why we worked on some of these features on the skull, because now they should be coming back to you as, well, these are important for determining biological sex. Because males typically have larger musculature in the neck and nuchal region, they will have a larger protuberance, right, or projection posteriorly and inferiorly, because they need to anchor those neck muscles. Anywhere that you have large muscles or a muscle on bone, it always needs to create some type of process or anchor for that muscle. And so you can see that individuals with prominent neck muscles or nuchal muscles, they will have a very large and prominent bone kind of spur that is there to anchor those muscles. And typically females don't have very prominent neck muscles. They're not as large and body size as males, and it will be much more gracile. It may not be very prevalent at all, so you would score that a 1. And so if you were given a skull, right? Now, if you were the forensic anthropologist and somebody gave you a skull, you would probably score all these features, among a few others that we're not necessarily going to mention. And then you would probably add them all up to determine whether it's more likely male or more likely female. And sometimes we might say it's indeterminate in terms of skull. And then if we had the pelvis, we would go to that. Or you would look for other indicators that might suggest one or the other. Because remember, you got a 50-50 chance for the most part here. Because sex is oftentimes interpreted as binary, one or the other. And so if you were, scoring all of these in unison, that might give you the greatest chance of making the best determination. At the same time, you may have a forensic case where you just have parts of the skull or parts of the cranium. Maybe you just have a piece of the temporozygomatic and the temporal, and all you have is the mastoid process to go on. Well, that would be it. You would say, well, this is a very prominent mastoid process, or it's not. And this feature is most likely male or female, depending on the size of it. But then you would have to probably explain in your forensic anthropology report that this is all you had to use as a determination. It might not be totally conclusive. Now, there are other ways to determine sex from the skeleton, the human skeleton, and of course, the pelvis is probably the most accurate. When we look at the pelvis, right, there are a number of different features that can tell us whether you have the pelvis of a male or a female. I have, the image on the left-hand side has a male at the top and a female pelvis at the bottom. It is the right pelvis, the right side. All the bones are fused together, the ischium, the pubis, and the ilium. And we're looking at the anterior aspect. And you can see here that the shape of the pubic bone is one way to tell, and it's actually a very accurate method, whether the pelvis is belonging to a male or a female. And the shape typically is the narrow pubis you see in males versus the elongated pubis in females. Now you can see the elongated pubis in females, very, very prominent. There's a lot more bone that's produced at the area of the pubis, and this typically has to do with the extra bone that's produced there to create a buttress for, a stressful event like childbirth. Males don't need that much bone there to help protect them from this process because they don't bear children, at least in humans. The subpubic angle, because of the elongated pubis, what this does is it makes the subpubic angle much more obtuse. And in males, it's much more acute because the pubis is narrow and there's not a lot of bone that's accumulated there. And so when you put the pelvises together, the subpubic angle of males looks like a V shape. And because the angle is much more obtuse in females, they will actually kind of look more like the shape of a U. Number 3, the size of the greater sciatic notch. Because females need to have wider pelvises, they will typically have a greater sciatic notch. In this image, where it says sex differences in the greater sciatic notch, you have the same kind of scoring technique on the skull chart that was shown in the previous slide. Males typically have a very narrow sciatic notch. That would be a 5. And females typically have a much wider one that's moving towards like a 1. In the image, it shows a left pelvis. And typically what we do is we look at that area of the greater sciatic notch, and sometimes you can put your thumb in there. And you can try and see if you have some wiggle room. In this case, this looks like the image of the pelvis, the real pelvis image that you have there, the left pelvis there. It looks like a wide one. And so if you put your thumb in there and you can wiggle it around, it looks like you've got, some pretty good movement. You can look at a sciatic notch that would be scored a 5. You put your thumb in there, your thumb can't really move much. That shows you that it's quite a narrow one and likely male. The ventral arc, this is a slight bony arc that you will notice on the ventral aspect, right? Some of those terms, ventral, dorsal, anterior, posterior. On the pubis, it's a slight lift of bone that occurs, and it's on the image of the female pelvis, on the right pelvis, on the image on the left. You can see that the male, because they have a much more acute subpubic angle, there's really no bone that's produced because of it. And that bone the ventral arc is produced because there needs to be, again, a greater buttress of bone to protect this wide pelvis that you typically see in females in comparison to males. The shape of the pubic inlet, number 5, is also another way to determine whether a pelvis is male or female. Well, I'll show you on the next slide kind of what this looks like. Lastly, I'm going to show you how we actually determine a number of these factors in unison. So we're going to put them all together. Typically, males' pelvises are much larger, much more rugged. You can see that the male pelvis is on the left and the female pelvis is on the right. Male pelvis is obviously larger. some of the areas, the muscle attachments and ends, they're much more rugose and rugged, whereas the females is not as robust. It's smaller and gracile, and it doesn't have a lot of these prominent features. The pelvic inlet is typically heart-shaped on a male and elliptical on the female, and that's typically because you have an elongated pubis and you have greater sciatic notches to create a greater area for the obstetric pelvis, the one that is responsible for the areas for childbirth. The subpubic angle, as was mentioned, is much more acute in males and much more obtuse in females, and that will create different shapes. Look at the subpubic angle on the male pelvis on the left. You can see it has a V, whereas the female pelvis on the right looks more like a U shape. The ventral arc is typically not present in males, it's present in females, and the sciatic notch, greater sciatic notch, which we've already mentioned on the previous slide, is narrow in males and it's much wider in females. So just like looking at the skull, if we have the complete skull, we want to look at all the features in unison. That goes for the pelvis as well. We want to look at all these features together. If we only had one because of preservation, or that's the only piece of the bone that was recovered from a crime scene, then that's all you're going to use. But you would also, again, in your documentation, you would put the caveat that this is all we have. There are other features that are missing because we don't have more of the pelvis or parts of the skeleton preserved, and it could be different in other areas. And so, again, this is something where you want to use as many features as possible and available to you as the forensic anthropologist in making your determination of biological sex from human skeletal remains.